circle of cartoons, we are back, and well, if you're wondering what happened to the news segment, this is going to be coming on later in the program. However, at the moment, we are going to be discussing flabby skin, face wrinkles, and the various chemical treatments that can go on with it. And with us in our studio, we also have Dr. Muhammad Al-Nassir, who is the head of plastic surgery department. And assalamu alaikum, good morning to you, sir. So as we are talking on towards the aging signs, which are mostly women are concerned about it, men do not really care much about it. In fact, they take it as a matter of pride of the experience showing up on their faces. However, when it comes to flabby skin and wrinkles, it is a growing awareness is going on about it, and much of the women already know exactly what to do with it. But they are using all sorts of cosmetic creams, which are available on the supermarket shelves and the pharmacies. It is widely available for all of those who are willing to buy it. How effective do you think they are? And when is it that we should go ahead to a plastic surgeon for the variations of the difficulties that they're facing up, and the makeup is not hiding it anymore? So what is it that we should do?
I believe, first, thank you for the presentation. Women start having wrinkles usually at the age of 30 if they are from the Caucasian descent, like in Western Europe and North America, while the Arabs usually have it later. It usually starts from 40 or 45, and black even at a later stage of age start at 50. So it has to do with the type of the skin. So the darker the skin, the less wrinkles we have. And usually, the best thing is to have a plastic surgery consultation at the age of 28 or 30 before you start getting wrinkles, so he can guide you what's the best treatment for you, whether it's chemical treatment in terms of Botox injection, or if it's like chemical peeling, or if you need both, or you need fillers, or some wrinkles can be treated with lasers. And right now we have different type of lasers. We have the ablative, coagulative laser, through laser, in the huge variety of lasers, or she can opt for surgical treatment. So it depends on the lady. It depends on her complexion, her skin type, skin pores, and her medical status as well.
Well, it is also said that ladies with drier skin get wrinkles a little faster than those with the normal to oily skin. Is it actually true, or is it just a myth?
No, it's not true.
It's true.
It's not true.
It's not true.
Yeah, it's so actually, it has to do with the complexion of the skin, how good the skin is. But regardless of whether it's dry or oily or something. Probably oily skin is more prone to other skin condition like acne. But you can find acne as well in dry skin patients.
Indeed. Now, Dr. Muhammad, when we talk about skincare nowadays, there are, of course, there are proper clinics and hospitals where they have skin treatments going on, but also we have got like a dime a dozen beauty centers and clinics all over the city. In every neighborhood we get to see a beauty center, or even perhaps a beauty salon only, where they are providing a lot of different kind of services. Microdermabrasion is also one of the things that so many women are actually going for. Is it necessary for these kind of females who go for such kind of extreme procedures such as a skin peeling, which comes with microdermabrasion, to go just to an average beautician who perhaps does not have appropriate knowledge or proper background of it, who's just doing it on a small scale with a different kind of machines that they are getting nowadays even in beauty salons? Or is it more advisable for those females to go to proper doctors, cosmetologists or plastic surgeons to have extreme treatments such as microdermabrasion, and do they actually even help?
You mentioned a very important point. Actually, I believe the best thing if she goes to a plastic surgeon, because the surgeon, he's the only one who knows the anatomy of the face or the body in general. Other people, whether they are physicians or healthcare workers or beauticians or cosmetologists or something, they have nothing regarding the anatomy. So they don't know what kind of muscles which lies in the cheek, what kind of muscle which lies in the forehead, around the eyes. If he wants to do dermabrasion around the mouth, what nerve will be affected. So it has to have like, the practitioner has to have like in-depth knowledge of the anatomy in order to practice, whether it's like dermabrasion, whether it's chemical peeling, whether it's laser, or even the thing that you mentioned, the microdermabrasion. The beauty salons, you try to make something like looks easy. It's not like dermabrasion like the traditional one, but it's micro, and some people, they can do it at home. You know, but in beauty salon, they will go further. They do some kind of peeling, and I face so many patients. They coming from salons that they got burns, and so the consequences of that is very huge. So I recommend that if she goes to a plastic surgeon, so he will guide her like what's the best treatment she needs.
Indeed.
Yes, definitely. Previously, doctor, I did ask you as to how much do anti-wrinkle creams work?
Yeah.
Because nowadays you're seeing ladies who get into their mid-20s and they start using the anti-wrinkle creams just to save themselves from the trouble later on. Is it effective, and is the collagen inside, as it is promised on the boxes, really does work?
I don't recommend like to start anti-wrinkling treatment at the age of in the 20s. I believe like you can start from the age of 30, 35. That's a good thing. And it depends on the composition of this treatment. Like you have to have like the protein is called hyaluronic acid or collagen. So you have to have a good product that's prescribed by a physician. You cannot just go to the pharmacy and get an over-the-counter cream or something. But if you're going to use it as a protective measure, that's good. But you have also to concentrate on other things, not just the creams. You have to concentrate on sport, on diet, on healthy food. So it's like a lifestyle. It's not just the creams that would work. Like, so if you use creams and you are smoking, that won't help. You get my point?
Right. Dr. Mohammed, recently we were having our discussion, which was just like a little while ago, with another doctor who has his own proper clinic, who has a very good reputation as well. And I would not mention the main name, but he said on live television with us that a lot of people say if you drink 8 to 10 glasses of water every day, or 10 to 15 glasses of water every day, your skin is going to be clear. If you drink orange juice, apple juice, and all those fresh fruit juices and vegetables, your skin is going to be clear. If you eat raw vegetables, your skin is going to be clear. He said all of those things are myths. None of it is true. Whether you ever drink milk, whether you ever drink fresh juices, fruits, or drink water or no water, it does not have anything to do with your skin. Lest you apply any of those things externally on the skin, it does not have any effects on the skin. Is this true? What do you say about it? We are trying to get more of the reviews from the different plastic surgeons and cosmetologists, so that our viewers would actually have one idea, because nowadays viewers are really lost. Not just viewers, I mean people in general are lost. One day I go to a bookstore, I buy a magazine that says doing this to your skin every day is good. Home remedies or tips. Then the next day there is a study published in the newspaper that says, oh, this kind of a thing is bad for your skin. One day you get to know from one of your friends or from a magazine that it is very important for people to literally apply sunscreen every single day. The next day you read off a magazine or a newspaper that these are all myths, this is not true, it's not reality. So much of the use of sunscreen could be harmful for your skin as well. So people are really lost. What is it that they're supposed to do?
Different points, interesting points. I believe like the say of the doctor, drinking water is very important. That's very true, you know. Like 8 glasses or 10 glasses, because like 70% of our bodies is water. So if you get this body hydrated, well hydrated, so it will be like reflected on the complexion, on the skin. But it won't like to be like some kind of replacement to other measures. So if I would tell you something, I would tell you something related based on studies. And these studies should be published in medical journals and literature, medical literature. As you mentioned, that I would go to a bookstore and buy a book, or I would see a magazine or something, or a newspaper, an article published in the news. Actually, as a physician or as a scientist, I don't look at these articles frequently. We have like a scale and we have like measures to classify articles. Articles can be very weak and it can be very strong. And what you see in the media, there's some kind of very weak article that shows up from once in a while, just to draw the attention of the viewers. You know, that's because like you know that the field of plastic surgery now is media driven. So regarding the point that you mentioned, if I would reply to the points of just drinking 8 glasses of water will suffice, that's not true. You have to do other measures. You have to stop smoking. You have to do a lot of sport. You have to use moisturizers because you can see that we are living in Saudi Arabia. The weather is very tough, you know, it's dry. So we are using AC. The AC is here, AC at home, so it makes your skin dry. So you have to use moisturizers. You cannot just use water, okay? Regarding the point of I would use just sun cream, sunblocks. That's not very important. That we have, yeah, like a sun in Saudi Arabia that's very strong. Like if you would just use, you can see it also your friends. You see a lot of your friends. They have like dyspigmentation on their skin, on their cheeks, on their hands. They have so this is related to the sun. So if you would just not use sunblocks on a daily basis, you won't get the effect or the result needed. So you have to use like sunblocks, and it's not my say. When I tell you something, I don't just tell you something from my own practice, because as I told you, if you just say science is different. Like I came from North American, Western European kind of school. You cannot just say, oh, this is my advice to you based on my knowledge or my observation. If you say something like this, the strength of your say is very weak, because even if you are a super doctor, you can see like 2,000, 3,000 patients a year. But I'm talking about studies that actually being studied on thousands and thousands of patients in North America and Western Europe, for example. So they would just screen like probably 50,000 ladies. So you won't find any physician will get this kind of experience. So the conclusion of the study, if you want to have really, as you mentioned, like I would go to a bookstore or I go to a magazine and I find like this kind of result, you have to really go to Google and you really search on the PubMed. PubMed usually is like a medical reference, a website that would just show the...
Again, what's the link?
PubMed.
PubMed.
Yeah, P-U-B-Med, which actually all the medical literature is being listed there, and which is actually genuine and being tested on big number of patients. But those studies, like anybody can do a study, but whether it's weak or strong, that's the thing that, the strong thing that it's the one which would help you. But weak studies won't really help you, so you cannot rely on it. But you can read from now and then, you can get different ideas. You know?
And perhaps it will help you and perhaps it won't, because there are certain things which work on different individuals and they won't on the others. But so what I do want to ask you, since you are the head of the plastic surgery department, and for myself, plastic surgery, I have a big cross on it in my head. Well, I'm very young for it. This is very far-fetched. But I have often seen, well, you see media personnels all around the world from various nationalities. And when they have any kind of plastic surgery pertaining to even the Botox injections, their face starts looking dead because you eventually do look like plastic. And as appealing as a Barbie looked to me as a child, it does not look appealing to me anymore, because when ladies start looking like Barbies, it is just not a pretty sight, because they have no emotions on their face, and you can literally tell by looking at them that they have gotten some kind of a procedure. If you cannot even put your finger on what procedure they have done, it is very much visible. So what kind of a treatment would you say which is not going to be making a face look like plastic, yet helping the wrinkles, and how often should a lady go ahead with these collagen injections and the fillers and the different kind of cosmetic surgeries?
First of all, Botox and fillers women have to start from the age of 28, 30. You know, even in the States now, they are using, females are starting using Botox from the age of 20. there are studies that showed like it would act as a preventive measure of wrinkles later on in the future. So if you would be 60, you will look like 50. You mentioned collagen. We don't use collagen anymore. What we use it here, the people say it's collagen because they have misconception about the product. The product we use, the same product, is called hyaluronic acid.
Hyaluronic acid.
Okay. It activates the synthesis of collagen in your body. But we stopped using collagen. We used in the 70s, early 80s, collagen, which was like derived from bovine source or from cows. And we used to do some allergy tests because it's from animal source, and so nobody's using collagen now. But people like saying it's collagen, but there is nothing called collagen. So you have to use fillers and Botox. That's you have to use it every 4 to 6 months. That's as a protective measure for you. The thing that you mentioned about plastic or whatever, some people go excessive, you know. You have to be in the middle so to have the good results. Some people, they would just be like obsessed with the term beauty or plastic surgery. Actually, if you look at it, beauty doesn't exist. Beauty lies in the eyes of the beholder. So we're going to say, and the other thing, might say, if you like something, you find it pretty. If you don't like it, nobody will convince you it's pretty, even if the other person looks at it as a pretty thing.
Indeed, and I mean, upon the lines of beauty, I mean, like just yesterday, we saw late at night the results coming out of the Miss Universe pageant, actually, and which was given actually out the title to an Angolan beauty who may not be looking appealing at all to people perhaps in Asia, where they think that white is beauty, so that means that if you have fair skin, you're beautiful, and if you don't, then you're not. And that's the reason that the whitening creams are so popular in the Asian part of the world. But I mean, like, you know, they have like an international criteria for beauty because it's an international pageant, so they gave the title to a girl from Angola who has really dark skin. But there are different standards of beauty, as we say. I mean, in every culture there are different standards of beauty. But nowadays people are so much striving for beauty that sometimes they forget other aspects. And so many of the people, even from here in Saudi Arabia, where we have got amazing derma clinics, where we have got great plastic surgeons, great cosmetologists, great skin doctors as well, great dermatologists on that level. But however, any kind of skincare treatments or derma treatments, especially if you do it at a reputed hospital or at a good skincare center, costs you a decent amount of money, quite a bit of money, we'd say. So for that, a lot of ladies are opting out because nonetheless, whether it's expensive or it's affordable or not affordable, they are all in the pursuit of beauty. Now, for the ladies who possibly do not have the means to spend as much going to a derma clinic only because maybe they have other financial obligations as well, what they do is during the summer vacations, which just finished, a lot of ladies travel to other Middle Eastern countries to have cheap plastic surgeries, to have cheap collagen or, as you said, the different acid which is used, or Botox treatments as well. A lot of them end up looking like frogs because they are doing it at not proper places. A lot of them go and have, like, you know, different things injected into their lips, and, you know, they have such terrible pouts that they would really remind you of a frog. It's just like, you know, God created beauty and then men destroyed it. So what do you say about these kind of people who are actually opting for cheap beauty treatments?
Which really does end up looking cheap.
Yeah, first I would like to thank you for this important say. People really, they have this kind of misconception about going to nearby countries, getting treated with plastic surgery.
I mean, and sometimes, honestly, Dr. Muhammad Al-Nassir, something which may cost you literally 5,000 here could literally cost you 500 riyals outside of Saudi Arabia.
You're right. But the problem, there's no guarantee.
Yeah.
There's no warranty. You know, I see a lot of these patients who got treated. I don't have to mention the countries.
Yeah,
Everybody knows
indeed.
the nearby countries where they got treated. They will come back with a lot of complications, and the cost of treating these complications are 2, 3, 4 times the amount of money that she would have to buy it here, to pay it here or somewhere else. But she's not thinking about the consequences. She's just thinking, okay, this amount of money here, that amount of money there. So it's not about the money. about the quality of the service you are getting provided. Me personally, I provide service to my patient that's state of the art, that's same that she's gonna get it in Paris, where I got treated, where I got trained and worked in Paris, or in
So
North
what is
America.
the best part of the
you
world
know?
to have any skin treatment for the ones who can afford?
Saudi Arabia.
In my clinic.
Very
I believe,
humble, yeah.
no, I believe like you have to make a search about your physician. That's the bottom line. You have to look at the center or the hospital where you're gonna get treated, because you are doing something in your body, and it's the most valuable thing for you. You cannot just go. I see a lot of patients. They just go to any kind of hospital or any kind of center because we are in Riyadh or in Saudi Arabia, and they just look for the cost. Okay, this is center A or Doctor A would offer botics with this amount of money. The other one is this with it. So it has nothing to do with the other physician who made it like more expensive. There is a reason for that. He got more training. He's doing more workshops, being trained, or he's really a trainer. You know. Me personally, I'm like a trainer of the workshops in fillers or botox. That needs a lot of like time dedicated by the physician, going abroad, being like involved in like dissections and cadavers, and it's not doesn't come like easily. So what you mentioned about it's like a lot of cosmetologists are doing it. So it has become like almost like as an open market. Everybody wants to practice at a beauty salon, and we have to look at it. It's really medicine. Any procedure that you are inflicting on the human body, even if it's even a needle stick, it's medicine. Patient can get really a lot of complication out of that. From a needle stick, patient gets really allergic reaction, and he can drop on the table, really unconscious. So we have seen that. So you cannot just take things lightly. What happens in the media right now, we just make things easy. They want to attract a lot of women, a lot of ladies to their beauty salon or the clinic. So they say, oh, it's easy. It's just like you come in 5 minutes and when you go out. It's not like this. You have to make really good search about your physician, about your doctor. You have to know his credential and the center. What kind of center? Do they have a lot good products? Do they have good equipment? If you're going to get treated with plastic surgery, you know, you have to make your own homework.
Indeed. Dr. Mohammed Al-Nasser, I mean, in your opinion, I mean, would you recommend our viewers right now who are watching us as to if it is better for them to go abroad, I mean, whether to one of these Middle Eastern destinations, saving up money or not saving up money, whether you go to Beirut or you go to Paris for your beauty treatment, would you recommend it to them that they travel and actually afford the best possible thing that they could get, or would you recommend it to them that it's safer and better for them to choose the best amongst the options that they have right here if they're residing in Saudi Arabia, to choose the best dermatologist, the best cosmetologist, or the best plastic surgeon that you have here? So given if you have any emergencies later on, if you have any complications later on, you could always be doing numerous follow-ups with this doctor who is residing in the same city as you.
You are very true. I mean, your relationship with the plastic surgeon is a lifelong relationship. It's not just something, some women they look at beauty that as she's going to a beauty salon or she's going to a Chanel buying a perfume and that's it. You know, it's one-time process. So she found this kind of product that's cheaper there, she would go and get it or buy it or something. No, it's a human kind of relationship. You would find the best doctor that suits you. You will develop this kind of patient-physician relationship, and he will guide you through your own aging process. When you reach 30, what things that you need to do. When you reach 35, when you reach 40, if you get pregnant, after pregnancy you need some kind of contouring surgery of your abdomen, abdominoplasty, thigh lift, facelift later on in 50s. So you cannot just go to someone and you lose your history with him, you know. Someone who would have your own history. He did for you different procedures. He knew things that would better suit you, what things that doesn't suit you, you know. So you cannot just go abroad even if this process is just once and you would just save some kind of money. But on the long term, if you find a very good surgeon, plastic surgeon that you can trust, that's the best thing, you know.
Most definitely. Moving on towards how much is too much? And perhaps this is the one battle that women of whatever part of the world they're coming from are really struggling with, because they often see these pop stars, moreover Middle Eastern pop stars, who really do look like somebody's holding their faces back because mashallah the skin is so flawless that you really want to look for some flaws.
It's so tight. Yeah.
Yeah, it is really, really uptight, and it seems like maybe their skin is going to start breaking in pieces as to how pulled back it really does look. And it is just about very unnatural to look at a face like that. And, well, there are a lot of audiences who find it extremely beautiful. To have just about no emotions on their faces, they find it beautiful, and that is the reason they go in the pursuit of that. But you being a plastic surgeon, how much of these conditions would you say is just very unnatural and it does not look good? From the point of view of a doctor who really does deal with different kinds of skin conditions, what would you say is perhaps the line of beauty that a woman in Saudi Arabia should look for, especially considering the fact that earlier in the program you have mentioned that ladies, the Arabian women, do not really begin the signs of wrinkles till a certain age in the late 30s or even 40s at times. So what kind of a treatment would you say should be banned literally from the face of this earth? Because I honestly think this face lifting, which really does look like plastic, should be gone, because it really, really makes me feel extremely frustrated to see beautiful women going into a doctor and having their faces absolutely destroyed. And even if they do not like the outcomes, what is it that they can do for it? So what is your take on that?
I believe you are very true, as well as with your colleague, in the same line, you know.
Yeah, because we're from the same family.
Yeah, I did a study like regarding the measures of beauty. What we look at when we look at beauty, like people in the Western Hemisphere or in Brazil or in Western Europe, is different than Middle East or Arab or people from the Gulf. So the thing that you mentioned, people are traveling to a doctor in Beirut or someone else in Europe. He has some conceptions of beauty doesn't suit you, you know.
Right.
So you have to explain to him things. So he would try to tell you that I will do this and I'll do that, but he will not get you to the same, you know, to put you on the track that you want, because he has some conception of beauty that's different from yours. So that you will end up with a plastic face and things. So because he tries to imitate the thing that he have locally, but it really won't suit you at all. So even that we mentioned that you have to get like a plastic surgeon that he works locally, so he gets more. He is acquainted with the beauty, that the local beauty, because it's different than other. Like if you look at the Brazilian lady, it's different than a Saudi, it's different than an American. There's different measures. You cannot really just say that I would just want to look like her. It doesn't work this way. There are some kind of measures that better suit you. You know, you cannot just say, oh, you look at the photo, I want to be
Make
this
me
one.
her.
Yeah, so you cannot just do like this, you know. You have to look at what things that really better suit you. That's the bottom line, you know.
Indeed. So, well, you could actually forget about the fact that you cannot really possibly pick 3 pictures and say, I want Nancy Ajram's nose, or I want Maisal Maghribi's lips, and I want Diana Haddad's cheekbones or something. Do not actually do that.
More than 30 operations to look like them, so just forget about it.
Or especially, like, you know, do not try to follow up on faces as well. Try to, by different means, enhance the beauty that you are gifted with naturally as well. You do not have to look like a supermodel or a singer or an actress in order to be beautiful. You could be beautiful just being you as well. With this, Dr. Muhammad Al-Nasser, we'd like to thank you so much for joining us in today's edition of the program. We hope to see you back again soon, or perhaps maybe sometime we would actually bring in our cameras into your hospital to try to show different kind of equipment and different kind of things that people could actually do with the face.
Inshallah, you're more than welcome.
Thank you very much, Dr. Muhammad Al-Nasser. It was a pleasure having you on the show. With this, ladies, we hope